Hi, this vlog is going to be all about my ophthalmology rotation, and I'll tell you about my life so far as a brand new first year family medicine resident, intern here in the US as a foreign grad. If you're new here, my name is Aura, and if you're interested, then keep on watching. Right now, wait, where do I put this vlog cam? I don't know. Maybe here. Don't fall. So right now it's my lunch break. Typically we have noon conferences every lunchtime, so we get free food, but we have to go to the conference room to learn things while eating. But today we don't have conference, so I got to go home and eat my own home-cooked meal. This is my favorite, sinigang na munggo. It's just mung beans with sinigang mix. And finally, I get to eat rice for lunch because, as you know, American food does not include rice. And I love my rice. And I'm like scooching down here, but yeah, at least you can see me. Wait, let me just put this in the microwave. I know that doesn't look so appetizing, but it's healthy. It has munggo or mung beans, spinach because we don't have kangkong here, and bacon because I don't want sliced thin pork anymore, and sinigang mix, which my sister gave me. I should have brought more, but you can't bring this in the airplane. They're gonna catch you in immigration if you bring one of these, so we had to buy it from the Asian store here. Sinigang mix, my favorite. And then, so while waiting for that, let me just tell you about my ophthalmology rotation. Well, so as you know, I'm a brand new intern, like I said. Ophthalmology is my first rotation, and I'm doing family medicine, so we do rotate in almost all the departments. And for ophtha, it's 2 weeks. We don't get to see our own patients, like our own ophtha patients. We're mostly just shadowing or like following around the attendings, and we just observe what they do. We're not really trying to learn the procedures that they're doing, like how to do them, but it's important. I believe it's important for us primary care physicians to have an idea on what our patients go through when we refer them to the specialists. That's really my main goal with this rotation. Like, I'm not a med student anymore. I know for sure that I'm not going to ophthalmology. So I'm not trying to learn like all the specialist stuff, especially their skills and whatever, but I'm trying to be there as if I'm a patient. Also, I'm trying to take note how the attendings explain certain procedures to them, their management to them, to the patients, and I'm learning a lot, like a lot. So my food is ready. Let me just sit down. Right, so what was I saying? So my schedule is just 8:30 to 4:30 p.m. And like I said, every lunchtime we have noon conference, except on Wednesdays. I have to drive from the clinic to our other clinic where we have our noon conference. So for me, that's good practice because I'm just starting to learn how to drive here in the US. And I'm just thankful that driving here is easier than in the Philippines, obviously, because the roads are wider and at least everyone seems to follow the traffic rules. Let me just eat. Charang! Ang dami. This is a big plate. Anyway, I'm gonna finish eating first, and if I still have time, I'm gonna talk more about my rotation. Kasi ang baboy ko kumain, no? Okay, never mind. I'm late. Well, not yet, but I have to go back to the hospital. It's just a like less than 5-minute drive. So I think I'll make it. But yeah, I'll continue this vlog later. And what am I supposed to get? My bag. It's right there. Let's go. Okay, bye. See you later. Ha! I knew it. Cause I don't remember putting my hanger here. And I'm always like paranoid. Someone broke into my apartment or something. And someone did. I already know who. They're here! Yay! I was just telling my attending a while ago that I don't even have any weekend plans. So I guess now I do. And they brought all their laundry. They usually come here to do their laundry here. Anyway, might as well finish my vlog now. I made notes. So if you're a med student and you're considering ophthalmology for your residency training, then keep on watching. To be honest, I never considered this field only because my best friend already declared that she will pursue this field. And okay, so I thought, okay, you do that, you do ophthalmology, and then I'll do something else, and then we'll just refer our patients to each other in the future, you know. And then I ended up moving here to the US. But anyway, in my experience, I really enjoyed ophtha because I saw it in a way different light. A lot of the patients are elderly, so you gotta put that into consideration, that a lot of your patients will be the geriatric population. So if you love them, great. But there's also diversity. Of course, you can see kids and adults with different eye complaints. But I'm saying that a lot of your long-term patients are seniors. And they come in because of a lot of problems. Most commonly, like macular degeneration, cataracts, diabetes, like the eye manifestations of diabetes, glaucoma, dry eyes. Dry eyes are very common. For those with chronic illnesses like diabetes, they follow up with an ophthalmologist every year, at least every year, to make sure that the blood vessels behind their eyes are doing okay and not gonna cause any problems. So ophthalmology is like a medical field, but also it has a surgical field, like a surgical component. So like I said, cataract extraction is very common. It's done in less than 20 minutes. So the tendency is the ophthalmologists, they have a surgery day wherein they can do like 7 to 12 cataract extractions in one morning. I got to observe one surgery day. So it was a nice experience for me also. I mean, obviously I didn't do anything. I just watched the screen. But I also made sure to observe how the nurses operate, the surg techs, the anesthesiologist, and how the whole team operates basically, and how they work with the patient. So I think that's one way to learn also when you're doing your rotations. You're not just there as the doctor, you're there to really learn from everyone. And again, like I said, you also want to learn from the patient himself. Like how does the patient feel before the procedure, during, and after, so that eventually you will know how to explain it to future patients who will get cataract extractions, you know. I also saw a lot of intravitreal injections. So like they put medicine straight into the eyeball. This medicine prevents new blood vessels from forming and popping and causing like bleeding behind the eyes. These are usually done like every month, at least for 3 months, and then for every 2 months for the next few months. So it's a long-term relationship. So that's kind of one of the ways wherein you can establish like long-term care with your patients. So that's nice, right? So if you want to take care of patients long-term, then ophtha will allow you to do that. And then the caveat of like long-term care is that some feel that they don't see the results right away. So there's no like satisfaction, some would say that, but somehow that is offset in ophtha again, because for example in cataract surgery, once the surgery is done, like even the same day or the next day, it's like an instant relief for the patient, and it's very satisfying. So for example, the best success story that yay! Whee! Hey! Surprise! You know why ako na-surprise? Kasi parang bakit nandyan yung hanger?
Si Bong nilagay.
Eh, alam ko ko, wala yan dyan. So, kinabahan ako kasi nung isang araw, nakalimutan ko ilock yung pinto pag uwi ko bukas. I'm so stupid. Tapos, I saw this. I'm like, they are here. That. And then, I saw this maleta. So, I was like, whoa, where are they? Nag-vlog pa naman ako nung pumasok ako. Oh, shit. Party! Weekend! Weekend! Gagawin natin.